The Senate Committee on Health, Education, Labor, and Pensions will please come to order. Over-the-counter drugs are part of the fabric of Americans maintaining their health, treating common ailments, including pain relief, allergies, and cold symptoms. I could use a little bit right now, at an affordable cost. They're available at every pharmacy and virtually every grocery store nationwide. Being readily available to Americans, OTCs save Americans a lot of money. The drugs generate an estimated $1.46 billion in annual sales from annual savings from fewer doctor's visits and prescription drug purchases. For decades, OTCs were required to go through a cumbersome review before going onto the market. This process, known as a drug monograph, typically took years to finalize. Many new OTC drugs were never fully approved. The review also made it more difficult for the FDA to update safety information on these drugs, sometimes delaying safety recommendations for several years. As a result of these challenges, Congress created the bipartisan over-the-counter monograph drug user fee program, OMUFA, in 2020 to streamline FDA review of OTC drugs, making these drugs more quickly available to Americans while still ensuring safety. OMUFA is set to expire at the end of this fiscal year. As Congress looks to reauthorize, we must see how we can further improve the program to better serve Americans. This is why today's hearing is so important. I highlight today is the first time Congress will be hearing directly from the FDA about how they've implemented reforms to the OTC drug review and their plans to make more low-cost drugs directly available to Americans. I appreciate Dr. Corrigan-Correa coming before the committee on behalf of the FDA. While the FDA has made progress in improving the OTC review pathways since 2020, there is more to do. FDA has failed to ease regulatory hurdles that allow prescription drugs to be sold OTC. These delays make it harder for consumers to directly access low-cost treatments. The agency continues to struggle with reviewing new sunscreens. Despite the well-documented public health value of using sunscreen, FDA has not approved a new sunscreen filter since 1999. In contrast, peer countries in Europe and Asia have many more high-quality sunscreen products available to consumers. The FDA needs to do a better job with sunscreen. I look forward to discussing how Congress can improve OMUFA and the OTC review process. And with that, I recognize Senator Kaine for his opening statement.